Welcome to Madison Noteworthy Health. I'm Dr. Frank Byrne, your host, and I'm privileged to be here today with Jonathan Barron, the CEO and co-founder of healthfinch.
Thank you for having me, Frank.
Thanks for being with us, Jonathan. So tell us about healthfinch. What is it? What do you do?
Yeah, so we started down the space, and I started the company with a physician out of Northwestern, and his name is Lyle Berkowitz. He's a physician by training, but he was a doc talking about all the routine, repeatable work that he wished was off his plate. And so really what we're all about as a company is taking the routine, repeatable work that falls on the physician's plate and their staff, and using the electronic medical record and technology that's built on top of it to get it out of their way. And our one area of focus that we started with was around prescription refill requests. So it's just one of these areas that primary care docs in particular are completely overwhelmed with. So our first piece of technology called Swoop goes in and gets that off the physician's plate and either automates away the work or it delegates it away, so it allows other members of the team to take it over for them. I've started to refer to this at a high level as autopilot for the physician, right? So how do we take the 80% of work today that largely falls on the physician's plate and use technology to automate or delegate away what they don't need to be bothered with? And so this really, for us, Swoop, this first application around prescription refills, is just the starting point.
So what are some of the challenges you faced in taking this idea you had for healthfinch and moving it forward and making it a reality?
Yeah, no, it's a great question. You know, I like to think about starting a company. You know, it's all about the friction that you have initially, right? So you have an idea. You don't know if it actually makes sense in the market. You don't know if you can build a product that actually solves it. You don't know if you can scale it. You don't know if you can sell it. You don't know if you can build the next application. You know, it's the culmination of all of these different areas, and that's what I think makes entrepreneurship exciting, right? Is you have this opportunity where you're going to face a diverse set of challenges. So you're going to face that first challenge of selling that first health system, selling that first customer, and convincing them of what you're doing is important enough for them to invest their time, their energy, their dollars. You're also going to then have to go out and execute on the product. You're have to make them happy. You're going to have to build out ways to scale your sales team. And so all of these different areas are challenges. But the way that I look at them is they're fun opportunities to learn and immerse yourself in the business. And you're gonna have to knock down all these different barriers over time. But the challenges are going to be different based upon the business.
So in speaking with many entrepreneurs, it seems like that index customer, getting customer one, is the biggest hurdle they have to overcome. What advice do you have about how to get customer one?
If I had one piece of advice for entrepreneurs, it's all about focus. So the challenge is that when you're an undifferentiated product, when you're doing what everyone else says they already do, then it's a really hard value proposition to get in the door, right? So if I'm one of a sea of thousands, that's very challenging. Now, what we did very early as a company is we said we're going to focus on one area. We're going to do it really well, and that area was prescription refill requests. Focus is incredibly important because you want to be loved. If you have the choice, you want to be loved by a small number of people rather than liked by a large number of people, because that's how you drive passionate customers that are going to serve as your base for further expansion. Because you're going to leverage those early customers, you're going to turn them into reference customers, they're going to talk to your people, they're going to prove that it works, and then that's going to serve as your foundation for jumping off from there.
Well, thank you for joining us on Madison Noteworthy Health.
Thank you, Frank.
I'm Dr. Frank Byrne, your host. See you next time.